This is Investigator Insights Lesson 3 with Dr. Cynthia Ma. We're going to talk about ongoing trials of CDK4/6 inhibitors. Currently, 24 trials are evaluating the safety and efficacy of cyclin-dependent kinase 4/6 inhibitors in patients with breast cancer, and 16 of them are actively enrolling patients. In general, what types of patients may best be treated in a trial?
Yes. So in clinical trials, patients usually have to be healthy enough. Usually there's a performance status requirement, and then there's also organ function requirement. These patients are mostly has to be healthy enough to be able to participate.
The PENOLOPE-B trial is a trial examining the effects of CDK4/6 inhibitors after standard neoadjuvant therapy. What are the inclusion criteria for that trial?
So PENOLOPE-B trial is examining palbociclib in patients who has undergone neoadjuvant treatment that contained a taxane regimen, and they randomize patients to receive either palbociclib or placebo in combination with the standard of care of hormonal therapy. They select patients who have high-risk features based on the residual cancer characteristics. So these patients are early stage. They can be premenopausal or postmenopausal to have started with. They've completed their surgery and with or without radiation treatment, depending on whether they need it or not.
The PEARL trial is examining the effects of CDK4/6 inhibitor with exemestane for patients who are resistant to nonsteroidal aromatase inhibitors. Can you tell us a little bit about that trial?
Okay, so the PEARL trial is examining palbociclib to combine with the exemestane versus chemotherapy to see whether it will be more beneficial than capecitabine. So the trial population or postmenopausal women who had metastatic estrogen receptor positive HER2-negative breast cancer and had progressed on prior nonsteroidal aromatase inhibitors such as letrozole or anastrozole.
What are the inclusion criteria for the MONALEESA-2 trial examining postmenopausal women with advanced breast cancer?
So MONALEESA-2 trial is examining another CDK4/6 inhibitor, and it's called LEE-011. So this is looking at first-line setting in patients who are postmenopausal and randomizing them to either letrozole in combination with placebo or letrozole in combination with LEE-011.
The MONARCH-2 trial examining the effectiveness of CDK4/6 inhibitor in combination with an anti-estrogen therapy. What patients were eligible for that trial?
This is also in patients with metastatic disease and postmenopausal women with estrogen receptor positive HER2-negative breast cancer. The trial has eligibility for patients who never had treatment, which is first line, or patients who had disease progression on aromatase inhibitors, so it can be a second line as well.
What tips do you have for identifying patients who may best be treated with these clinical trials?
So the trials that we discussed about, many of them are open in multiple different centers, and clinicians can find them from the clinicaltrial.gov. It will tell you the recruiting status. I think just keep in mind when you see a patient with metastatic estrogen receptor positive and HER2-negative breast cancer, so you think about these trial availabilities. In addition, there are many phase 1-2 trials of these 3 different CDK4/6 inhibitors are ongoing, and they are combining with different targeted agents, such as combining with mTOR inhibitor, for example, the LEE-011 in combination with everolimus. And also this agent is being tested in combination with PI3 kinase inhibitors.
So a lot of possibilities.
Mm-hmm.
What are the highlights to remember about referring patients to clinical trials of CDK4/6 inhibitors?
So I think in the clinic, when you see a patient with metastatic estrogen receptor positive HER2-negative breast cancer, keep in mind that these trials are available. There's also a expanded access program for palbociclib, and in that program, there's no limitation on prior therapy, so maybe it's an option in patients who has good performance status and good organ function that they may be considering this.
That's very helpful. Thanks a lot.
Okay, thank you.